Thank you for being here with us today. My name is Joy Williams, and I'm here with my colleagues Samvrit and Adil to talk to you about global responses to COVID-19. Unfortunately, one of our colleagues, Radia, is not able to be here today, but we're still very excited to share this information with you. On November 17, 2019, the first case of a novel coronavirus was detected in the Hubei province in China. Since then, over 12 million cases have been confirmed, and we have surpassed 550,000 deaths. With fear and panic spreading throughout the world, the 214 countries are doing everything they can to minimize the spread. With many reports comparing COVID-19 to the flu, what makes it so dangerous? Well, it has been said that the worst pandemic of modern history was the Spanish flu of 1918. Despite this learning opportunity over 100 years ago, many countries have still failed to adequately respond to the coronavirus we know today. So this begs the question, what differentiates a successful response from an unsuccessful response? When attempting to answer this question, we took into account risk factors such as obesity and average age of population. Next, you'll hear from my colleague Samvrit about actions taken or not taken by countries who had a relatively poor response to COVID-19.
Thank you, Joy, and hello, everyone. My name is Samvrit, and today I'm going to be presenting to you about countries that were unsuccessful when it came to dealing with coronavirus. Now, the first country that I have to talk to you about today is Italy. Now, the situation with Italy is one that I'm sure many of you are already familiar with. It's that they have a very high average age, sitting at around 49 years. Now, this is the main reason why they have around 36,000 deaths. However, it is not the reason why they have so many cases. They have around 3,900 cases per million and a 77% recovery rate. My colleague Adil will later speak on a country that reacted within 2 days of the first global coronavirus case. However, Italy reacted 50 days after their first coronavirus case, which is an astounding period of time. The next country that I have to speak about is Belgium. Now, Belgium is a country that not many of us are familiar with when it comes to coronavirus. This is mainly due to the fact that they only had 9,700 deaths, and this may seem like a very insignificant number for us. However, to them it is a very significant number due to the fact that they are a very small country. Looking at their statistics, they're very severe. They have 5,224 cases per million, and they have a 27.5% recovery rate. Also, their lockdown was 43 days after their first coronavirus case. The next two countries that I have to speak about are the UK and Spain. So, as you may have noticed, all the countries that I have here today are all from Europe. This is mainly due to the fact that Europe is a very small area with a very high population density, which leads to spreading of cases a lot faster. So when it comes to the UK and Spain, overall, they're very similar cases-wise. They have around 4,300 deaths in the UK and 5,200 in Spain. Deaths-wise, it's 42,000, it's 21,000 in Spain. And their lockdown in Spain was 43 days, and in the UK it was 34 days, which is only a 9-day difference. Although all these things link the two countries together, the two important things to keep in mind that link these two countries together are the fact that, one, when it came to the government didn't really enforce strict COVID regulations, and along with that, the citizens didn't really abide by these already loose COVID regulations. Now, speaking of citizens who didn't adhere to COVID regulations, you have the US. So many people may say the US did very bad when it comes to COVID. However, as you can see on this table that we made, the US isn't really doing too bad when it comes to coronavirus. As a matter of fact, they are rated good at a 3.11 rating. The main reason for this is when it comes to cases, the US is really doing bad, as I mentioned before, because citizens aren't listening or adhering to COVID regulations proposed by the government. By the way, these COVID regulations proposed by the government are overall semi-strict. They're not too bad. And the reason the US has so many deaths is not because, as my colleague Joy mentioned earlier, mainly due to the fact that the US has many previous risk factors, such as heart disease, obesity, and an old age of around 39 years, which is slightly above average. So, in general, the US didn't really do too bad when dealing with coronavirus compared to these other countries. It was mainly just the citizens' fault for not adhering to these COVID regulations. Now my colleague Adil will speak on countries that did good with coronavirus.
Hello everyone, today I'll be presenting on the best 4 countries in response to the COVID-19 outbreak. So first we have New Zealand. Now as my colleague just mentioned, New Zealand went into lockdown just 2 days after the first global case. So for some context, this was February 2nd, and New Zealand just heard that the Philippines had received their first case. This allowed them to close down their borders to any foreigners and only allowed citizens in to a 14-day self-isolation period. Now fast forward to March 16th. At this point of time, New Zealand closed off its borders to everyone, including its citizens, and it still had its borders closed off to foreigners. This meant that there was no more 14-day self-isolation period, and no one could enter or leave the country. Now, I believe that it was because of New Zealand's quick prevention that they were able to limit the number of cases and limit the number of deaths they had. Now, a country that had a high number of cases per million is Iceland. Iceland had 5,349 cases per million, but this number is only so high because of their small population of around 350,000. Because of that, we had to scale their numbers upward to match my other countries. You might also notice that Iceland did not go into lockdown. They also did not mandate the use of masks, and they did not close down businesses except for hair salons and bars. Even so, the solution they implemented was a contact tracing team. Now, the contact tracing team is comprised of police officers, nurses, and criminologists, and they basically track anyone who is infected with the coronavirus. So they do this in 3 degrees. The first degree being they find anyone infected with COVID-19. Then they find anyone who's associated with that person. And finally, they repeat steps 1 and 2 with that last set of people. And as you can see, COVID-19 contact tracing through COVID-19 is very effective with a 99.2% recovery rate. Now, another country that had the same exact solution is Vietnam. Vietnam also implemented a tracing team in the same exact manner with that same 3-degree testing method. They also went into lockdown, unlike Iceland, but their lockdown was 42 days late to take another precaution because of how escalated COVID-19 had become at this time. And through this, they were able to have a 96% recovery rate and a low number of cases per million, all while having 0 reported deaths. And finally, we have Taiwan. Now, Taiwan is another country with a big population, unlike the first two, with over 25 million. Now, with Taiwan, they were able to have 7 deaths and a low number of cases per million. And their solution was the National Health Command Center. Now, the National Health Command Center was founded in 2003 to combat against a SARS outbreak. What Taiwan did was they used the same policies and guidelines and infrastructure they had for the SARS outbreak and implemented them against COVID-19. And this was very effective, as you can see. Now, a trend among most of my countries, New Zealand, Taiwan, and Vietnam, is that they're all located in this oceanic part of the world. This part of the world is in really close proximity to China, so it's astonishing on how they're able to do so well. Additionally, the contact tracing team is a very effective solution regardless of population size. Iceland has a small population and Vietnam has a population of over 95 million. But now my colleague Joy will be ready with What Can We Learn? Thank you.
Thank you, Adil. As my colleagues have previously mentioned, the world was generally unprepared and ill-equipped to handle such a large outbreak. The healthcare systems were overwhelmed and not up to par. But through our analysis, we have concluded that with policy change, better financial allocation, and an overall reboot of the healthcare systems, we can create not only effective change, but sustainable change. In the event of a second wave or the next pandemic, we suggest implementing the 4 E's, which are an early warning system, e-health, ethics, and equity. An early warning system is an essential part of this plan as it allows us to predict the next pandemic. Currently, the World Health Organization is working on a new technology called EpiBran, which utilizes artificial intelligence and other data collection techniques to predict the onset and behavior of the next pandemic. This is an essential part of proactive prevention. Furthermore, e-health and telehealth technologies allow us to reach patients that might otherwise not be reached. We have seen firsthand through SCARF that not only do e-health services allow us to reach patients, but they allow us to maintain the quality of healthcare while reducing the risk of infection. This is why continued funding for e-health and telehealth services is an essential part of planning for the next pandemic. Additionally, research shows a positive correlation between pre-existing heart disease and cardiac complications due to COVID-19. For a patient with no pre-existing conditions, the death rate due to COVID-19 is about 1%, while for a patient with pre-existing cardiovascular disease, it is an astonishing 10%, according to the CDC. Despite this, many fail to realize that we have an even greater pandemic on our hands, and that is sudden cardiac death. Every year in the United States, 550,000 people lose their lives to sudden cardiac death, as opposed to the 150,000 who have lost their lives due to COVID-19. This is why it is more important now than ever to protect your heart. We here at SCARF are dedicated to eradicating sudden cardiac death through raising awareness, donating AEDs, and training future healthcare professionals. As you can see, even a global pandemic can't stop us from pursuing this goal. Thank you for listening and supporting our cause.